Hello, my name is Zoe Arnold. I'm a student in the Accelerated BSN program at Methodist, and I will be talking about sexual education reform in Nebraska for my Capstone project. So there are a few reasons why I chose this topic. One reason is because Omaha is the 13th leading country in the state of Nebraska for having the highest STD rates. The state of Nebraska also has no policy or curriculum surrounding this topic currently because sex ed is mandated by state. And then a nursing school has brought awareness into how much poor sex education can affect one's mental and physical health. So I thought this would be a good topic to present about. Here I just incorporated a few visuals that I included in my paper that I thought would be beneficial to understanding the issue. So on the left is a graph of what states mandate what regarding sex ed. So the key goes over things like mandated sex ed, sexual orientation, whether it's inclusive or non-inclusive, if only abstinence is taught, if there's medically accurate information. So it's kind of cool to look at what states teach what. And then on the right, this is just a snippet from curriculum from last year from OPS from the high school level. And when people think of sex ed, I think they just think of sex. And so it can bother some people, it can bother parents, but I think it's important to realize that sex ed encompasses a lot more than that. As you can see, they talk about senses, they talk about different body shapes and sizes, consent, saying no. We can discuss family structures, domestic violence, all these kinds of things that are very important to be taught. Otherwise, you'll see high rates of unwanted pregnancies, STDs, domestic violence, and things like that. So now I will jump into my experiences at Methodist and how they relate to my topic. So my first experience for my effective communicator prompt was on the psych unit at Jenny Ed. I realized the role of implicit bias along the mental health care continuum here, and it led me to questions like how do our implicit biases impede on people's access to care, clinical screenings and diagnoses, treatment processes, and crisis responses. The US has a mental health pandemic right now. We don't have a ton of resources for people who are experiencing crises or need help. And because of this, I think there's a lot of stigma surrounding mental health. And I unfortunately went into this experience a little nervous because I didn't know what I was going to see on the psych unit. And I realized how wrong this was and how important it is to bring light to the situation. So I realized it's important to turn the conversation away from the stigma by bringing light to the struggles of the disease and the struggles of not having enough access to resources for people who are experiencing these. So in relation to my topic, I learned that being proactive and taking initiative about what is important to you matters. And this is a big part of what being a change agent is about through effective communication. For my next effective communicator experience, I was on the PACU floor at Methodist, and it was a heparin infusion verification with the pharmacist on the floor. There was a 15 kilogram weight difference between the ED weight and the actual weight of the patient, which is a significant difference in their weight. And the reason this is a really big problem, it's a problem with any med, but with heparin especially, it can cause huge bleeding disorders, and it can even lead to something as bad as a hemorrhagic stroke. So if we would have infused the heparin at the rate that was given to us for the incorrect weight, there would have been a terrible outcome with the patient. So once us and the pharmacist had talked and the medical team kind of figured out what it was we were supposed to do, it helped me realize communication is very necessary across the entire medical team. And if it hadn't been for that communication, we would not have figured out what was wrong with the order. So again, relating to my project, I realized as a state, we need to be able to provide evidence-based, comprehensive, and free education surrounding the topic of sex ed. To even get to this point, we need people to advocate for this. They need to start up organizations, and they need to spread the message through effective communication. So all of this stems from being an effective communicator and being effective on a team. And then for my third experience as an effective communicator, I was shadowing a health coach in Fremont. I learned how valuable it is to have someone in your corner and communicating with you and helping you every step of the way through your health journey. And what I learned about being an effective communicator from this experience is that it's important to ask a ton of questions. So, what the health coaches do is they follow up with any patients that visit the ED. They have 2 days to get back in contact with them just to see how they're doing because we want to prevent readmission into the ED because we want to see good patient health outcomes. And then these health coaches also worked with diabetic patients, which they had over 1,600 of in the clinic. And I found that without these health coaches, the patients wouldn't necessarily be on top of their meds and their health, and they're very transformative in their health journey. So relating to my project, evidence-based research and teaching is important when it comes to sex ed. Younger adults have many misconceptions about sex, and by clearing up this misinformation through effective communication, we could spare so many poor health outcomes. So for my first experience as a reflective individual, I wrote about my Being Mortal book / paper. This book challenged my assumptions about the geriatric population and our approach towards medicine in our aging population. I realized it's important to engage in things that can shift our thoughts and actions in the world around us. And we can do this many ways. You can do it by watching the news and staying up to date on them, encouraging critical thinking, empathy, staying on top of education, and challenging your own views. That's exactly what this book did for me. This dual experience of reading the book and writing my essay about the book challenged me to think past our society's normal and to dig deeper into what morality is and how to grant this to our patients. And this is something I'm definitely going to carry with me on to my next job as a cardiac ICU nurse. It's important to engage in things that we aren't so comfortable with because there are so many more views than our own and than what we were taught at Methodist. And this has really helped me reflect on that experience. So again, relating to sex ed, reflection on the statistics for the different states and how or why some of them are doing better than others can help our community specifically also have better health outcomes. So I did a lot of digging into why the places that had low STD rates had low STD rates. And I found out that they had a ton of cool programs like peer-to-peer education programs where you have your own peers your age discussing sex education and sex topics. And sometimes that's taken better from people your own age. And then also places that have comprehensive sex education like Sweden or Canada have way lower STD rates. And that's because this education is made free for the public. For my second experience as a reflective individual, I also wrote about the health coach experience, and I focused on the preventative care and the follow-up care that the nurses gave to their patients. So I engaged in habits of inquiry with deep critical thinking skills, engaged in other social sciences, and exhibited personal responsibility. What happened during this experience was we had many conversations with the older population, and I found that a lot of the diabetic patients were not taking the correct dosage of meds at all. The health coach would call them, they would ask what their blood sugars were at night and the morning averages, and they tend to be really high because they weren't very compliant with meds. And then she would ask them, so how many units of insulin are you taking, just to see where they're at? And they were always taking way too little insulin, and that's why their blood sugars were always so high and they had to keep coming back. So I just realized how important it is to be a part of preventative care, a part of education, and part of follow-up care with our patients and with our community. Relating to my project, it's important to evaluate your population and your community needs and to fulfill them in a way that would be most beneficial to them. I think that the Omaha community has huge needs for sex education as evidenced by the high STD rates, and they lack free sex education and helpful resources that can help lower these STD rates and poor health outcomes. For my change agent experience, I wrote about health screenings at a middle school that I did with my clinical group, and this was in the very beginning of the year. We participated in primary level of intervention with the hopes of catching anything abnormal and referring them to a specialist before it became a bigger issue. I learned how important it is to be the one to take action and to fulfill the needs of your community. And this is the position that I take on sex education. Um, it was a really cool experience because we were the ones who were able to go to the school, do all these screenings with just one other nurse. So we were really the manpower behind the whole project. And it was cool seeing how many things we did catch and the free referrals that we were able to give to children at no cost to the family to help them and to help prevent a problem from becoming a bigger one down the road. So, in conclusion, during the past year at Methodist, I feel that I have been well molded into an educated citizen throughout my time spent effectively communicating, reflecting, and acting as a change agent in my community. I'll apply these concepts to my future job as a cardiac ICU nurse and as an educated citizen in the community. I'd also love to take it a step further and participate more with other organizations in Omaha to try to implement things like peer-to-peer education. The only issue is finances, and um, I think it would be really cool to see something like that implemented here in the community. So, um, yeah, I think this whole capstone project has helped me realize how important it is to be a part of my community, to be the change agent that I want to see, and it's been very, very beneficial to my learning and my time. And then here are the references I used for my presentation. Thank you guys for watching.